This is focusing on care. Those who attended our last conference in 2012 in Myanmar would recall that the conference main theme was care. And here we are looking back also at what we have done since then and what care means for older people in the community. Uza will make the first presentation on the care experience of the network since that last conference in 2012 in Yangon. Uza Kerwood is the HelpAge International Regional Program Manager, working for HelpAge for a long time, maybe since 1996, now 1995, long time, about 20 years of work with HelpAge. It's my pleasure to introduce her to see what has happened since our last conference in Yangon. Thank you, Uza. Please.
Thank you, Vesum, and good morning, everybody. And as Vesum mentioned that I will briefly provide an update on what have been undertaken in relation to care by HelpAge International in Asia Pacific and the network in the region in the past 2 years. So I will present a few slides on the last conference and also what have been done and what we are going to do in the coming years. And that will be my presentation. So the Asia Pacific Region Conference on Aging was held in May in Yangon in 2012, and the theme, as Vesum mentioned, is on rapid aging, a caring future. That's how it's titled, and it brought together a large group of policymakers, academics, and other development partners from 27 countries. And of course, since Myanmar is a host country, a large group of participants came from Myanmar. So this photo capture, you probably saw it also the other day, yesterday or today, that the photo capture active participation of participants. And sadly, some of us have left for the better place, and actually many of us from that conference are here today. And we have someone like John Beard from WHO, we have Ms. Nobugo from UNFPA, and of course many familiar faces as I mentioned. And during the conference, the 5 priorities had been identified for the HelpAge International in the region and network to do something about it, to take forward. And this looking at, to gain a better understanding of care need and the situation of older person, and also expanding the partnership. And in addition, it was suggested that we should develop a sharing model of affordable and sustainable for care services, and this particularly for the community-based model. And of course, we also gave importance to carers, that they should be more supported through training, and also increase the national and regional advocacy to ensure that the care of older person be improved. And in taking the priority forward, 2 main initiatives have been undertaken at the regional level. The first one is that it was agreed that we should develop and implement a strategy on care for HelpAge and network. And the other one is developing a community-based services for in the country, the Cambodia, Laos, Myanmar and Vietnam, the CLMV country. So the progress and so far includes these 4 activities. The situational analysis has been conducted. The community-based service, a study on community-based service, community care approaches for older person also conducted. And a strategic direction on care for older person have been drafted. And last, the community-based service in that CLMV countries also being implemented by a number of partners in the region. The situational analysis cover a review of terms relating to care and aging. This is often that different perception, different understanding of terms used by service care services and also policymakers sometimes create conflicts. And by having this better understanding of different terms used in the region will be useful. And for example, terms like care in old age, older people, family and home care, or community-based care, which is our focus, and also the institutional-based care. What it really means when people who work in the field of aged care refer to this term. And the analysis also look at the current state of care provision in the region, and also presenting care gap, and also the forecast of care gap in the future, looking at the proportion of older person experiencing care gap at the moment, and also the projection of older person in 2050 by UN. And that will give us a picture of what will happen in the next 20 or 30 years. Country cover altogether 14 countries, and you see that it actually 10 ASEAN countries were included, plus Timor-Leste, China, Japan, and Republic of Korea. And we appreciate the support of European Commission and Age International for this study. For community-based care approaches for older person, I would like to skip these 2 slides because Professor Teen, who will be the next presenter, will be covering in more detail. So I think just to shorten the time so we have more time for the next presenter. For the strategic direction on care for older person that have been drafted, inputs have been drawn from Health Page, East Asia Pacific, and of course comment from our London office and the network in the region. And also the 2 studies, that the first one, the situational analysis, and the other one that Professor Teen will be presenting. And we also draw on comment and views from external experts in the region. And a regional workshop was also conducted to discuss and come up with more refined strategy. This strategy, the purpose of this paper is actually why we have been working for quite some time on the aged care, specifically on volunteer-based home care. This strategy is so that it will guide the health page network, particularly those working on aged care, to advocate on this particular issue so that care for older person can be improved. And by developing and implementing this strategy, we hope to reduce gap in social care for older persons through the provision of assistance in their own home and community. And some of us here will just have questions. We say, social care, what does that really mean? And Professor Teen will clarify that in her next presentation. In terms of the target group of the strategy that I mentioned, we will focus on older persons who are physically and mentally dependent. But even beyond that, we will look more into those who family support are insufficient, because these people are the group who suffer most when they need care. And in terms of care provider, we look at three main groups. The first one is self-care. This self-care we will focus on disease and disability management. We will not include prevention, disease prevention in this, but will be part of our other health program. And also family care. And family care in this sense is that when the family are providing care without support from the third party, whether they are government or local NGO or religious organization. And the third one would be the community care, which define as the care services take place in the community with a third party involvement. In terms of the priority action, based on those strategy, we have 4 key priorities. And the first two will look more into how to support family and older person themselves to have a better care and support. The first, especially family and self-care by older person, we focus more on advocate with the government sector. While for community care, we look into how the government sector and the CSO can collaborate and improve support for older person. And the third one, we will look at refining and documenting replicable and affordable model. And this we hope that it will lead to piloting the program that can be replicable and more appropriate implemented in the region. And last one, we look into ourselves, and that we ourselves at the network, we have to also build the capacity to be able to communicate, to be able to better service in this area. And in terms of developing and community-based service model, while we are developing, drafting the strategy, in parallel, we also implementing the community-based service model for older person. This led by HealthPage, our affiliate in Republic of Korea, and this building on the RC2014 volunteer-based home care program that were implemented between 2003 to 2012. So the new model will be addressing gaps that actually cannot be met by the volunteer-based home care model. And it's also looking at this more related to health issue of older person who suffer from NCDs. And as I mentioned, these are implemented in the 4 countries, Cambodia, Laos, and Myanmar, and Vietnam. And if you want more information about it, we have our lead agency and the 4 implementing agencies in this conference. So can discuss more with them. And my last slide would be, what we will be doing in taking the priority forward in the next coming years. First, the 2 report, the situational analysis study, the report, and also the community-based model. The report of that 2 study will be merged, and we will produce a publication that will be distributed to wider audience. We also plan to organize a symposium on aged care for policymakers. This will be policymaker, academics, or development partner to discuss. A part of it would be whatever come out from the 2 study, and also key point from those the merge report, but apart from wider experience within the region. And this we are discussing collaboration with UN HCAP. And of course then after the strategy, this strategic direction paper fully completed, then the implementation will be done. And at the end, we hope that since it is an interim strategy, it will be revised in the next 2 years, and this will be linked to our global health strategy of 2015 to 2020. So that my presentation. Thank you.